I have sensitivity to light and sound. What can I do about this? So with sensitivity to light and sound, it's most commonly coming from areas neurologically in the brain. So in the upper brainstem, it's kind of the final common area for light and sound and motion and visual motion and movement. It's called the midbrain. And that area takes a lot of force with concussions. They've shown that in the research with pediatric concussion to some of the research and literature with professional boxers. But that area of the brain basically dictates a lot of different activation up higher into the brain. And also it helps modulate your autonomic nervous system. And it has dopamine, that whole kind of feel good response, and the way that you're able to have good attention and focus. So we need to look at all your vertical eye movements. So if you're having issues with light and sound, we got to look at your eye tracking. We need to look at the ability of your eyes to converge and diverge, the ability of you to be able to fuse your eye movements together and look at the whole visual system. That system gets affected after TBI, and that could be leading to some of the visual problems that you're having. Hi, I'm Dr. Jeremy Schmoe, founder of the Functional Neurology Center in Minnetonka, Minnesota. We work with patients with unresolved post-concussion symptoms and other complex neurological issues. Our approach to complicated neurological issues is very different from other clinics. We use the latest technologies and a combination of functional neurology, functional medicine, and chiropractic care to get to the root cause of what is causing your problems. With this approach, we're able to get you back to optimum function and get you doing the things that you love to do. I have sensitivity to light and sound. What can I do about this? So not only can the problem be visual, it can be the ability of your brain just to take in motion and movement, and that actually involves some more reflexive areas of the brain that are in the midbrain. So with rehab, we can do a variety of different techniques to stimulate that area to make it more stable. So we might be doing stimulation on the jaw, or sometimes we even stimulate on the tongue. And then that gives input into the brainstem, and it can help kind of recalibrate that area. We also want to look at the neck, because the neck has a lot of input into that area of the brain. And then we want to take into account what's happening with your vestibular system. So if your vestibular system gets off after a concussion, then your visual system might go too high. So if one system goes down, the other systems start to function more. So if you don't know where your body is in space, well, your neck might get tighter. If your eyes aren't tracking right, then your neck might get tighter. And all of this integration, a lot of it happens in the midbrain. So instead of just putting glasses on you and filtering everything out and putting earbuds in and staying away from everything, we want to get really precise with our rehab and get very focused and get after it from that rehab perspective. And with doing that, we've helped thousands of people at our clinic get better with light, motion, and sound sensitivity. There is hope. There are answers. Click the link you see with this video to schedule a consultation with my office today.